I think the biggest benefits is the fact that I don't feel I'm firefighting anymore with our patients. When I first joined the surgery and I started doing these weekly ward rounds, I always felt that it was a ward round on the care home's terms, that they had problem patients that were picked up or issues that were identified probably a bit too late that they flagged up that I had to deal with. Whereas actually what's happening now is by having all the data and a lot of the information, and what we do is they answer the question sets for about 10 patients every month, so we cover the 40 patients a month at least, so everyone has a review monthly. By having all that information, you can actually start to see if a patient is going off or if a problem's arising. And that's the big difference. I'm no longer firefighting. I now feel I'm one step ahead of the game, which has always been an issue. So that's definitely been one of the biggest benefits. But another thing is I know these patients a lot better. I know them so much because some of the question sets that we've created have actually allowed me to have a greater understanding about not just their medical problems. So I'm not just calling up to do a medication review or to find out about how their arthritis is. You're asking a lot more in terms of the holistic information. So about how their mobility is, how their nutritional, what their nutritional information's like, how their weight is, how they go to the toilet, just mood and behaviour and things that I wouldn't have routinely always known about the patient, or I didn't have the time to. And I think that probably leads me on to like the next big benefit is the time factor. So I'm given like a morning, so about 4 hours to do ward rounds at our 2 care homes. There is a stark contrast in how quick I do a ward round, or how thorough as well I do a ward round at the 2 care homes. One I use CliniTouch and one I don't. So at the care home where CliniTouch has been implemented here, with that care home I find that actually I'm managing more patients per week in the same period of time, and I have so much more information on them, and that makes a massive difference because they're getting a better quality of care out of it as well. We're preventing big issues such as admissions when they become really unwell, and by preventing that or treating that here in the community before it becomes a real issue, it's obviously beneficial for everyone here. It's also reducing the amount of appointments down the line. So for example, by doing the ward round on the Wednesdays, I'm picking up on things that especially CliniTouch has really helped me with. It means that later on down the week, I've already dealt with that issue. So they're not suddenly calling up on a Friday afternoon or Friday evening with a big problem. So we're not having to use a lot of our urgent appointments on Friday afternoons for those care home patients, because actually we don't really get many calls from them now on Thursdays, Fridays or Mondays. A lot of these issues are being dealt with on these weekly ward rounds because I think we're one step ahead of the game.